Nearly 1 month since President Uhuru Kenyatta revised those containment measures, locking down 5 counties around Nairobi and limiting access to the rest of the country. 4 weeks later, more infections, more hospital and ICU admissions continue to be reported amidst more deaths that could make the month of April the deadliest in the country's battle with COVID-19. And as health officials battle with systemic and financial challenges, the average Kenyan appears to face the pandemic with abandon. Scenes of recklessness still in sight. Sam Gituku now looks at what could dampen the prospects of a flattening curve and reopening that had been expected mid-next month.
The revision of COVID-19 containment measures had been expected to drive the COVID-19 infections downwards and thus relieve the pressure on the healthcare system. Although the positivity rate has reduced from a high of 22% to a recent low of just over 9%, the virus remains stubborn. A monthly average of 14.7% positivity rate so far recorded. In the latest statistics, 904 people have tested positive of the virus from 5,673 tests conducted, a positivity rate of 15.9%. But since the presidential address on the 26th of March declaring more stringent measures, at least 26,200 infections have been reported. 462 people have died in the 4 weeks. At the time of the presidential address, 124 COVID-19 patients were admitted at different ICU facilities. That number has doubled to 244 as of Wednesday. 37 patients required ventilatory support on the 26th of March, and now 53 need it. Patients requiring oxygen support have more than doubled to 424, while total hospital admission rising to 1,509.
We are quite overstretched right now as counties. Here, people are gasping for air. Gasping for air. They are drowning and dying because of lack of oxygen, because of a disease. And mainly because of people really not respecting the regulations.
And as more and more patients die, it appears persons aged 50 and above are at a higher risk of succumbing to the disease. Of patients aged 60 and above, 8 of every 100 are likely to die of complications from the disease. Patients aged between 10 and 19 less likely to die of the disease at just 0.2%. Over the past 4 weeks, 5 counties around Nairobi have been partially locked down, movement outside the zone limited to special circumstances, but the numbers continue to rise within and without the zone. Nairobi leads the pack with over 11,000 new infections recorded since March 26th. Uasin Gishu and Mombasa counties reporting 4th and 5th highest new infections in the country. The spike has pushed the disease-infected zone to account for 64% of the country's disease burden. Experts, however, fear the numbers may not be reflective of the real situation, as not much testing is being conducted outside the 5 counties, and that no proper contact tracing is being conducted upon persons that test positive. And with the trend, the month of April could emerge the worst in the COVID-19 transmission. Already 20,334 infections have been reported, an average of 924 cases, higher than any other month before. On fatalities, in the 3 weeks of the month of April, 407 deaths have been reported, a number likely to surpass the worst month on record, November 2020, that recorded 473 deaths. But there is a concern. At least 9 counties have reported infections above 500 each over the last 4 weeks, notably Kitui, Uasin Gishu, Mombasa, Elgeyo Marakwet and Kericho counties, all of which are outside the DIZ. At the Masjid Musa in Mombasa County, worshippers are observing the Ramadan prayers now in the 2nd week. While some put on their masks, some don't have any, while others have no regard for proper donning. Social distancing is foreign here.
We don't want to get to a point where now we are forced again to make those very hard decisions of closing down places, or looking at cessational of movement to be re-implemented. In
Meru County, tea farmers have just concluded electing their representatives. As they celebrate, they throw caution to the wind. Sam Gituku, Citizen TV.